Yeah. For now, for selecting a topic, uh, when you write your objective and methodology, and then you develop your conceptual framework, then you have an opportunity to select the particular type of research that you want to do, design-wise, and then also, the which specific objective that you want to pursue. This stage will be there. But for now, what I wanted as an initial step is to select a topic, and then also the population, and then also the location. So I
Okay.
think these are some of the things that you need to do at this time. And then actual the methodology, there will be an opportunity to work later.
Okay then, Professor.
Yeah.
Yeah, thank
So
you,
yeah,
Professor.
before even selecting a topic, so what is also important to read a couple of articles on that same topic, and then if you see, try to see that what has been done in your population that you are thinking, you are proposing, right? Whether the whether at what level things it has been done, and then the reported already. Okay. When is the time that we wanted you to submit the topic and then population?
This
And
Friday,
then,
Professor.
19
19.
by this Friday, Professor.
okay, so we have few more days. So I want to hear from others. Is there anyone that you are, still struggling or not
Professor,
sure what you are going to do?
uh, do we need to specify the location as well or no? Like where we want to do our study.
Location you need to propose, yes.
So,
Location,
Professor,
population, and then also the topic. Topic means at least the subject area. Yes, Diana.
Professor, I think I need time till Sunday if it is possible for you.
19 is the time, so that's for everybody. But if there is something very very special, so we can extend. But 19 is in general. I'm not going to extend it for Sunday for everybody, right?
In case if it's possible, Professor.
This is your request, but for others,
Yes.
19 is still is the
Okay,
time.
Professor.
Yeah.
It's okay.
Okay. So
Professor,
yes.
this is Somaya. As I have many topics, but exactly I'm not sure which one should I select. So, what's your advice if I go through the EPI programs? So, I think through that part I can find many subjects.
So you can you send me a mail writing 2 3 lines that what you want to do, Sumaya? Then I can give you, I can get back to you, right?
Okay,
On
sure.
EPI, what do you want to do, and then let's see. I will give you feedback. Okay.
Okay, because there are many options, but I want to do exactly the topic which is kind of new. So
Hmm.
the other did not do it. So I was thinking for API. Okay, I will send you. Thank you.
Yeah. Okay. Okay. Good. Thank you. Okay. Oh, there are a lot of comments in chat box. Yeah, sure. Okay, I'm just going through quickly went through the chat box. Yeah. Uh, you see, 40 minutes gone. So, but of course, having this feedback it was important, right? To have because we should have, to get feedback. Uh, like in previous semesters, what we did is in midterm we had there was an exercise that we did. We give a handout a little the printed form to have feedbacks of what should be changed, how to improve. But this semester we have not done this. So this session was useful to have some feedback from you. So this was great, right? So we are kind of discussing about the sampling today. I guess that we need to finish this and in 40 minutes, and then I wanted to have a discussion on from the chapter 5. So we talked about the simple random sampling. Oh no, let's start from here. The probability sampling or random sampling and non-probability sampling or non-random sampling. So probability sampling is something that you give an opportunity that everyone has a chance to get selected as a study participant. There are again various type of probability sampling. Simple random sampling is the best one, but very most difficult one to do. Simple random sampling, for doing the simple random sampling, you need to have a sampling list, sampling frame, so that you can draw the number of individuals that you are going to select. But there are other ways of doing it, like stratified random sampling. Like in simple random sampling, what happens is you have no control as an investigator that who is going to recruit, who is going to be selected as a sample. But it could end up having more from one geographic area, having more selected from one gender, having more selected from one ethnic group, because this is completely clueless that who is going to select. But if you think that you are going to recruit people from having a rational distribution, like if you want to have equal proportion of men versus women, equal proportion from the rural area versus urban area, but simple random sampling do not necessarily ensure this. So in that case, the stratified random sampling is also useful, that you stratify, you give us two strata, men and women, and then you said, okay, select this many from men, this many from women. So you kind of forcing it to have, selected from two different strata. So stratified random sampling. Systematic random sampling is also another type that we are going to discuss. Cluster random sampling and multi-state. Non-probability sampling is also possible, and the non-probability samplings are mainly used in qualitative research. In quantitative research, we do use sometime, but in quantitative research, when we have calculated sample size, but we select sample using non-probability sampling. So this is something has a limitation, of course. It introduces selection bias to a greater extent if you use non-probability sampling. But in qualitative research, when you have a limited number of individuals that you require, sample size is not a big issue for qualitative research. For like in-depth interview, focus group discussion, or key informant interview, in that case, they most probably go for non-probability sampling for qualitative research, which actually makes more sense. So the simple random sampling we just covered, like everyone has an equal opportunity. So by doing the lottery method, table of random numbers or random number generator can give you. So it also has advantage and disadvantage is like difficult to have the sample list that is absolutely needed. And then there are also misconception about random sampling, right? As I mentioned that if you go to the crowd and then also ask 10 people to participate, so this is not a true random sampling, because when you approach 10 people, if it is even a crowd, which is a public area, but the selector or the people who approach them has some sort of the bias, selection bias. Either they select someone who is well dressed up, or seems that they can respond better to a particular issue. So this is not a random selection. Random selection is completely beyond the control of who is selecting, right? Yeah. So here is an example of simple random sampling. Define the population, determine the desired sample size. sample size calculation, and then list of every individual belongs to this group. This is absolutely needed for simple random sampling, the complete list. So this is possible in the school setting where the list of students are there in school. This is possible for if you have the list of a population or a community from the border list, or you can get a list from the Bureau of Census, Bureau of Statistics Department, then you can do it. Or from a research purpose, sometimes this listing is also done. For example, for a BI project that they want to do a 5 years project, randomized trial in a community, in a slum setting, in a big slum. So in order to do the sampling, initial 2 months, they do the listing. They sent 4 people in a slum to list every individual within the range, age group, or whatever the condition. So they make the listing from a project perspective, from a project site. So this is also possible. So you list at the beginning, you enter the list in computer, make a database. So from that database, then you randomly select number of individual. So, but having this list is absolutely needed. In public health practice, some setting, there are demographic health survey available, DHS. If you know about it, there are a number of famous DHS available in the world. DHS is called Demographic Health Survey, right? So there is one DHS in Bangladesh. In ICDDR, we maintain this in Matlab area, Matlab, Chatpur, where around 250,000 people in a number of geography. Every individual belongs to this geography. They have listing. Every birth, every death, every migration that they list every 2 weeks. One research assistant go there, and then they collect information of every demographic change. So when someone wants to do a research in those areas, so what they need is like to get access to this database. So this database, they update every 2 weeks. So a researcher going from Johns Hopkins University or London School of Hygiene and Tropical Medicine want to do a research there, they don't have to do listing of every individual. Rather, they can use the database that they collect locally, which comes under the Demographic Health Survey. So from this sample base, they can do the sampling. So this is also possible. That makes life easier for the researcher. That's a lot of research being done in those areas, right? And then there are a couple of famous demographic health survey DHS available in Africa, in many countries, in Kenya, and then I know in Burkina Faso there is also a DHS. So they maintain this database, collect information. So those kind of infrastructure is also helpful for doing simple random sampling. So you have to have a sampling list like this, as you can see, the potential subject pool from where you want to draw simple random sampling. So if you have a list of individual, you can say, for example, this list has 30 individual listed. So if you want to recruit 10 out of 30, so you can do through the lottery, or you can ask the computer to generate number out of 30, ask computer to generate 10 number randomly, so they will give 10 numbers. So the number comes up like 10, 22, 24 to 16 at the end. So these are your sample when you conduct your research. So these are the people that you collect data or interview them. So this is like simple random sampling, right? So you have to have a sampling frame. So random number generation is a computer program in SPSS data or Excel. You can ask that I have this many list in the people, so give me total number of individuals that you want, like the sample size that give this many numbers. So from computer will give you the random number, and then these are your number. Then you link with their personal information, and then collect data accordingly, right? So this is also possible. So any quick question on simple random sampling? Any quick question on simple random sampling, whether you want to do it or how do you see that it is feasible? But what do you, I mean, anything about simple random sampling? Have you done any simple random sampling in your research or with any project?
No, Professor.
Yes,
Personally, I didn't do
Professor.
any research.
Yeah. Yeah, okay, but you know as I said, and then I'm repeating one more time. Like sometimes random sampling is misunderstood. Like people think that okay, I choose randomly. How? So I went to the AOW lane, and then there were like 20 students. I randomly choose 10 and then talk to them. So that was random. But this is from epidemiology perspective is not random, because when you approach someone in the lane, so this is something you thought is random, but this is not epidemiologically random because you had some sort of issue that was in your mind to approach someone. So this is not really random, even if you just went to the lane and then picked 10 students from the lane. But this sounds like random, but epidemiologically, this is not random. So yeah,
Professor,
yes.
in that case, for example, not example, I helped one of my senior to do to get survey where we have to collect data. So basically from my side, I tried to be as random as possible. Like I went to the town where like many people are there, and I approached the people and then asked them about their whether they are willing to go do the interview or not. But then that is not a random, I think. You told that this is something like convenience, something.
Yeah, in convenience, there are also different level of convenience. So you gave some effort to go to the general people, like to go to a crowd. You have not
Yeah.
conveniently selected someone who is living next door or who is your neighbor, right? So you made some effort to go to the crowd. So this is convenience, but this level of convenience is actually it's not like the very absolute convenience. So you see the level you made to go to a crowd. You have conveniently not selected next who is sitting next to you or living next to your home. So I cannot say it's random, but it's like in the convenience level, convenience sampling, you made some effort. That's something qualitatively you can mention in your sampling, that even if it is convenience, but we made this level of effort in order to try to reach the normal, I mean the general population level, right?
Professor,
Yeah.
what
So
about if
Amal and then Yasmin. Amal
Yeah,
raised hand, I saw.
yeah,
Then Yasmin,
Professor.
I'll
So
come back to you. Yeah.
what about the online questionnaires? Are the subjects they're random?
The online questionnaire, like for example, if you reach out to 1000 email with a questionnaire, or if you just uh, put up your questionnaire online and then invite anyone get access to this questionnaire, they have an opportunity to accept this, whether this is random. So from strict epidemiologic sense, this is not random. You can customize and say that the way that you have done, but this is not random, because when you up your questionnaire and then it is open to anyone can accept your questionnaire and response. So some people for any purpose they decide to do it, or some individual they decide not to do it. So that's up to them. It's not that you have selected them randomly and then asked them to participate, and then you can of course count that how many actually accept versus how many don't accept. But if you just share with 1,000 people, or just open share in Google, through Google forum, and then at the end count that how many has completed. So this is not necessarily random, right? This is not necessarily random. Yeah. So Mudabbara. Oh no, yes, Yasmin. No, who is it? Yasmin, yes. Then Mudabbara.
Professor, Amal actually asked the question that I was going to ask.
Oh,
Like
okay.
you answered, like if we share in a messenger group or to a group to like 1,000 people, and
Yeah.
some chose to fulfill it, so it is not
Yeah.
random.
It's not random, but you can just mention that the process that you have done, right? So the convention and sampling that we have mentioned, maybe it is not fitting with any of them listed there. So this is okay. You just explain whatever you have done, because you know that there are emerging situation coming, like online survey is also one of them. The conventional definition of sampling, either random or non-random, may not apply, because these are something emerging. So you can present what you have done, yeah, to me it's not completely random, because it's up to individual that whether they accept or not accept the offer that you have given. So yeah, Mudabbara.
Professor, my question is, if, as Tandin was saying, she went to a crowd and tried as random as possible. So we are human beings. So how is it possible that if we approach those kind of group of people, then how can we be totally random if we are not generating the number from like any software or anything?
Yeah, that's true. So yeah, that's why you see that Tandin has realized that this is not random. As I also gave example the other day, like you know the TV reporter went to a crowd and then interview someone. So they went to the crowd and then pick someone to speak on an issue. So there might be some sort of you know the selection issue for this person. Like they choose someone who they think will be more explicit in their presentation, pick someone who has well dressed, looks good or something. You know, there's some sort of selection bias could be there, even that they went to the crowd, right? So that's why we cannot say this is a completely random selection. There should be some sort of, but it is not something, as I also mentioned, that they conveniently selected someone who is just their relative or living next door. So they made effort to some extent in order to make it more public oriented, right? So but you can definitely then mention this, the effort that you have made in sampling. Yeah, Ramisa.
Professor, in an internship I did the last summer, I mean the 2019 summer. So there I had to do a survey where we had to go somewhere. So will that be counted as simple random sampling? Like we had to go to Bashkhali and we had to survey random people. Like there was a number fixed, like the sample size was fixed, but we just the area was fixed, but the like the population was the whole area. So
Yeah,
there was no age or nothing, no like no
yeah,
demographic set.
no,
So we
okay.
can so will this be counted as a simple random sampling?
No, this will not be counted as a simple random sampling. So you have selected your sample size and then decided about a geography, and then but you did not follow the complete listing of the people that you want to sample. You need to draw the sample, and then you have not relied on a third party involvement to select them, like the generating tables or this random draw, lucky draw. You have not exercised any of this. So you went to the locality and then based on age criteria or anything, you choose whoever wanted to participate, right? So this is not random, even if it looked like random, but this is actually not true simple random sampling. So Buso, do you have any of this observation? Have you done any sampling from your research? Any of the sampling? Buso?
Um, if I have done any of the
Any
random
of this
sampling,
sampling in your research or in part of a research that you did, any sampling, and then any comment on simple random sampling versus others?
I do not have experience with random sampling.
or any other sampling that you have done or a part of it?
I haven't really conducted research for public health thesis. I only did a systematic review. So
Oh,
yeah.
okay, systematic. Okay, yeah. Okay, so another method of systematic random sampling, right? So as the method called
Professor.
systematic random, yeah.
Sorry for the interruption. Can you give an example of simple random sampling?
Example I think we gave, right? This is the example. So a potential subject pool for simple random sampling, you have to have a list like this. Like here is a list of 30 students, that out of this 30 student you are going to recruit 10. So so how you are going to, which 10 you are going to recruit, you have no idea that who is going to be your sample. So what you do is like you ask a computer random generator, give me 10 number that I want to interview, I want to include in a research. So this is 10 that highlighted red came out as a sample from the 30 in the list. So you see the 1 came up, 6 came up, 10 came up, 11, 13, 15, 16, just next to it came up. So, and then you have not selected them. You asked a lottery draw, like you write in a little piece of paper, the number 1 Ahmed, number 2 Munir, and then all this little piece of paper you put in a jar, because this is a small list, only 30. So this you can do even manually selection in random selection. So in a jar, then you pick 10. So, and then at the end, you have the 10 that are listed red. So this is your sample. So this selection of 10, you completely relied on whoever picked up from the lottery draw. Or you can ask the computer number generator, ask a computer, either SPSS Stata, any software will do. You ask them, I have 1 to 30. Here you will have limit from 1 to maximum upper limit is 30. And then you ask them, you need 10. So this computer will give you the list of 10. So this is something which 10 will come, will not within your control. So for simple random sampling, you have to have a sampling list, and then you rely on some other process to select who is going to be in your sample. This is actually
Professor,
true.
what is this upper limit and lower limit? Are we just entering random numbers or
No, not random number. Like the sampling frame. Here you see you have 1 to 30, right? So in this case, if you want to draw sample of 10 from using this random number generator, in the lower limit you will write 1, in the upper limit you will write 30, and then you will say that you need 10 here. So this is another screen. So here, like the list was from 1 to 200 individual instead of 1 to 30. Okay. So
yeah,
yeah,
we put the number of individuals.
number of individual in the list. How many are there in the list?
Professor,
Yeah.
like after selecting the
List.
population, we can use any software like this type of software for simple random sampling.
That's true. Any software you can use for simple random sampling, SPSS data. But if your list is small, you can even do it manually. Like you write their code in a piece of paper, put them in a jar, and then draw as many sample as you need, right? But if the list is very long, so do it manually using in the jar or any other method would be impossible, right? If you want to do the whole village, so there are if it is 1,000 people in the list, so it is not possible to do through manual way. Then you do it. You take help from a software or a table. Yeah. Okay.
Professor, thank you.
So the next one is systematic random. What the systematic random is done, like you take sample in every specific interval. Like for example, here the example, you have 10,000 people, 10,000 people in a university, and then you want to draw 500 students for a research out of 10,000. So out of 10,000, you want to draw 500. So this is 1 in every 20 student, 1 in every 20. So the systematic random sampling will be selecting which number you start with, and then you take every 20 of this, every 20th of this sequence. Like for example, out of 10,000, you want 500, right? 1 in 20. So then you said that, okay, from 1 to 20, which one I should start first? So this is the random part. So you choose a random number from 1 to 20, and then 8 comes up as a random number. So when 8 comes up, so then your sampling would be 8, then 28, then 48, then 68. So like this way you go until you reach 10,000. So that when you reach to the by 10,000, you will have 500 individuals already selected. This is called systematic random. You use a system, but at first you have also a random, like 1 to 20, you select one number as a random, and then you follow whatever the interval that you need. That's systematic random. So, but on in the
Professor,
but in the random, actual random, it could be the fact that you have only selected 15 and 16 together. But in systematic random, so there is a systematic difference, the gap you will be following. Yes.
Professor, I did not get, how did you like get 8?
Which one? How did you?
8,
Yeah.
the 8, Professor.
Oh, 8.
Like,
Yeah. How did you
yeah.
get the 8? So that's a very good question. How did you get the 8? 8 you get randomly. Like from, you know that you have interval of 20, because out of 10,000 you need 500. So it's like you need every, the 20th interval. You can have every 20 people, I mean 1 in every 20. So then which 20, from 1 to 20, which one to start with? You need to start with a number, right? So this selection is random. So you can randomly select one between 1 to 20. So how to get this one? So again, you can do the lottery method. You give digit of 1 to 20 in 20 piece of paper, and then randomly select one. So if the 8 comes up in just one draw, so 8 comes up as a draw, so then 8 is your starting number. Then you go every 20th, 8, and then next one is 28, next one is 48, next one is 68. So this sequence you follow. But how to get 8? You get it through a random selection from from lottery method, right? Mudabbara, yes.
Professor, my question is,
Yeah.
like, why do we do this systematic random sampling or simple random sampling? What is the difference? I mean, what would be the benefit of doing any one of that?
Yeah. So simple random sampling is completely random. So you have no control over who is going to get selected. But in the systematic random, you have only given chance to one between 1 and 20. Only random is only in this part, that who is going to pick out of 1 and 20, whether 1 or 2 or 3, or here in this case 8 got selected as random selection, and then 8 is selected, and then the rest are like mandatory. Like if 8 is selected, so 28 will be the next one. So 28 doesn't have any choice, and then 48 doesn't have any choice. These are like coming as a systematic way. So like 28 or 28 or 48 did not have any choice being selected or not. So this is why this is a mix between the random and then also system. Why this is needed? Then you are making sure that your sample are well spread between the total base of the sample, total list. So you see that if you follow this systematic random, so you go to the until end of the list to recruit your last sample. So samples are not, you know, distributed to any direction. So you give I mean from end start to end, you are reaching to all segment of the population in a systematic way. So this is something is needed in some context that you want to capture, you want to reach all part of a population in a systematic way. So there are advantages. Advantage is better in achieving representativeness, all strata like age, gender, or disease status. If you want to make sure that you want certain number from every group, so this is the way. Other simple random sampling could be some group can be counted, others could not, may not come. But the disadvantages is difficult to pick up appropriate strata, difficult to identify every number in the population. Like the simple random sampling, it also need the listing also, right? So stratified random sampling is another one that you have strata that you want to make sure that you have sample from every strata. So the time wise, so this is a problem. So we have how many minutes left? 25 minutes left?
Yes, Professor.
Yes.
Oh, okay. Oh, that's good. I thought only 5 minutes. Okay. So another type of sampling is the stratified random sampling. Stratified is something like, for example, the disease situation, hypertension. Some people have, a group of people has mild hypertension, a group of people have moderate hypertension. Another group that you know is a severe hypertension. And a research of a drug trial to see that how this drug is effective in hypertension. So you want to test your drug with people having mild hypertension, moderate hypertension, or severe hypertension. So then you do the stratified random sampling. You have a strata. Strata means division or group, mild, moderate, and severe in terms of hypertension. And then you want from every strata equal number of patients in your trial. So then you force your sample, you divide your sample in 3 groups, and then for example, if you have 300 sample, so you select 100 from mild, 100 from moderate, 100 from severe. And then how you are going to select 100 from mild, then you do the simple random sampling. So from the mild group, you select 100 randomly. In the moderate group, you select 100 randomly. In the severe group, you select 100 randomly. So what advantage is you are getting representation from all 3 groups. You want to see whether the drug works for mild, moderate, or severe hypertension better. But at the same time, you are selecting randomly within the group. So that's why it's stratified, but still random, right? Within the group, it is random, but you have strata that you want to make sure. This is true that you want 50% men and then 50% women in a research. But if you do the simple random sampling, you cannot guarantee that 50% men or 50% women will be your sample. But if you want to do stratified random, so you make sure, you can make sure that 50% men and 50% women can be there in your sample. So sometimes this is needed because here in this case, the drug, you want to see whether it works better for mild, moderate, or severe group. And then, for example, sometimes it is needed to have equal representation of sample from rural and urban. So stratified random sample works better instead of simple random sampling. So simple random sampling is always, it does not serve the purpose because you have completely no clue that who is going to recruit, who is going to select, and then it end up having more from one group, less from other group, right? But here in the other methods that evolve as based on their needs, because here you can have a control that you have equal representation from subgroups. So kind of, are you following to some extent the different methods of sampling?
Yes, Professor.
Okay. So cluster random is, on the other hand, all other random sampling we do on individual basis, the participant, a student or a community individual. But cluster, the random is done on the group basis. Like we randomly select a school between 10 school, out of 10 school, we select one school. The school become a sampling unit, and then all the villages, like one out of 500 villages in the district of Chittagong or in a sub district of the Chakoria, and then you select 20 villages as your sample. So when you go to the village, so you recruit all of them in the village. So the sampling unit is a cluster instead of an individual. So this is sometimes needed for a certain type of research. So here, so you have a geographic distinction, and then this two red group of, this is an example, right? Came out as a sample. So when you go there, so all the household within the cluster, you will be working with them. And the household in the cluster, all of them you will be working. So this the households are not the unit, rather the clusters are the unit for randomization. That's what they call cluster sampling. So cluster samplings are school, villages, or any other institution, geographic locations could be used for cluster random sampling. Multi-stage sampling is possible. Like sampling is done at different stages. First, for example, if you want to do a national-wide survey, and then how do you do it? Like, for example, in Bangladesh, there are now 8 divisional geography. Chittagong is one of them, Sylhet is one of them, Dhaka is one of them, Barishal is one of them. So if you randomly select 2 division, Dhaka and Chittagong, or Dhaka or Sylhet, randomly came as your sample. And then when you go to the Dhaka and Chittagong, you are not working with everybody. Then you select sub-district randomly. So from the sub-district, then you can select number of schools that you want to work with. So your sampling done at stages. First division, then you randomly select district, then you randomly select some other lower level. So this kind of multi-stage sometimes is needed for a bigger project, for a national-wide project. So I was kind of analyzing a demographic health survey data. So they use multi-stage sampling. So they worked all over Bangladesh or all over of another country that they worked with, but they use multi-stage sampling. They initially select district, and then within the district, not every sub-district that they work, they again select some sub-district. Then within the sub-district, they use the population is also selected, another level of sampling, random selection. So they use multiple steps in sampling. So this is also possible. So non-probability sampling is quota sampling, convenience sampling, purposive sampling, snowball sampling, and consecutive sampling. So purposive sampling, as I said, that these are mostly done from qualitative research, but quantitative research, this is also possible. Then of course you mention the limitation that selection bias is possible because of this sample, because you used non-probability sampling, right? So purposive sampling is like you choose your study subject, those who can serve the purpose. So for example, if you want to do a in-depth interview, you choose subject who you think can give more information. Like you, in the TB reporting, as I said, the people purposely select someone who can give more information. They were in the on the location when something has happened, an event has happened. So they choose someone who can purposely give more information to serve the purpose of investigation, right? So, purposive sampling is needed. Convenience sampling, you take them where you find them. So it's a non-random sampling, of course, right? You select who is living next to it. You select who is less expensive. So many consideration could be there in order to select someone with convenience, right? Convenience selection, it is of course a non-probability sampling method, and then selection bias is there. But sometimes convenience sampling, for example, if you want to do a pilot study to conduct a big research, so pilot study normally don't do random selection. You do convenience sampling and then see how does it work, right? So sometimes this is a pre-step before conducting a real research. For example, you want to see how your questionnaire is working. You want to see whether your questionnaire works good or sounds good, or then you do some convenience sampling and then test your questionnaire among these people to get feedback, right? So then, of course, this is a non-probability sampling. Deliberated quota sampling is also possible, that you have to have a certain number of people from a certain strata. I just submitted preparing a research proposal. Last night I was working until 2 a.m. and then shared the proposal to the investigator to get their feedback. So I want to interview one representative from an ethical review committee who are functional in Bangladesh, Bhutan, and few other countries. So I proposed a quota sampling, meaning that I need one representative from the committee member of the Research Ethics Committee to ask a series of questions, that how frequently do they meet, and then what are the steps that they follow for reviewing the research proposal. So those kind of things. So this is kind of a deliberate or quota sampling. I want one individual. I don't care who is that individual, but I want one from each research ethics committee. So that's kind of a quota sampling. You have to have certain criteria, and then you don't mind whoever it is, but you want one from every committee. So that's kind of a the deliberate or quota sampling. It has also advantage and disadvantage. Of course, selection bias is there because you don't know who is going to select. You give an option who can anyone, but maintaining a quota, right? Snowball sampling is very popular, right? You probably have heard. Have you heard about the snowball sampling?
Yes.
So do you know how does it work, Amal?
Yeah. So, for example, we go for a participant in our study, and then like these few participants tell us about others that we can approach, then we can like make the snowball bigger. It's like we start small and then we reach a greater amount of people.
That's true. Yeah, snowball sampling is very popular, and then very because of its name, it becomes very interesting as well. So yeah, you approach first to someone, and then you request that individual to refer other individual of similar kind, so that the ball become bigger in terms of number of subject that you recruit in a research, right? So snowball sampling is particularly, there are some abuse people do in snowball sampling. So, but the purpose of snowball sampling is that the population that someone is doing an investigation is somehow obscure or hidden. They don't want to identify themselves because the situation that you are dealing with, either drug or the behavior like MSM, or like some other behavior that is socially not desirable, is hidden behavior, hidden situation. That's why, I mean, it is not possible to do a listing for random sampling or systematic random sampling. It's not like the school student. This is something injecting drug user or the people who practice MSM, right? So those kind of hidden, so those people are not normally identified, right? They are like hidden group. So, but you reach to someone and then you convince this individual to spread the snow so that it becomes a bigger ball. So you ask them to use their network to reach other people in the network. So that's how the snowball sampling works. This is particularly important because someone wants to investigate a group. Those information are not very known to other people, but having information from those group is also important in order to for the for strategy or any other recommendation. But what the mistake people do is like they apply snowball sampling for like the situation or the research area where it is not hidden. For example, if you go to the Cox's Bazar and then the Rohingya community, you want to you want to recruit mother who are currently pregnant among the Rohingya population. So you don't need to do a snowball sampling. You can try to make a list through the healthcare worker or something, and then you can draw either whatever sampling method suits you. But people do snowball sampling there, the situation, the pregnancy, and then Rohingya population in a slum setting is nothing hidden. So snowball sampling does not work there. You should not apply this, right? So, Mudabbara, yes, go ahead.
Professor, what about the rape victims? So can we use this sampling for that?
Yes, I think so. Rape victim, people don't want to reveal, and then they're kind of, they want to keep themselves hidden or undisclosed. So in this situation, snowball sampling works perfectly, should work, right? But for a behavior or a practice which is socially accepted, there is nothing stigma or major thing is not associated. So I saw one professor, he wants to recruit, want to do snowball sampling in Rohingya camps. I said that snowball sampling purpose is not to recruit someone which behavior or practice is not hidden. So you can do just listing and then either do systematic random or quota, whatever, but you don't do snowball sampling here. So yeah, there is some abuse that the people do for snowball sampling, but this is very important, very useful, but apply only for those perspectives where it is not possible to do a complete listing of the people, like for example, the rape victim, right? So snowball sampling works better in this situation. Consecutive sampling is another one, which is also very useful sampling method. The consecutive, the word consecutive, from here you can imagine like whoever comes next. Like for example, if you want to do a research in the clinics or a hospital, and then in hospital setting, most of the time we do the consecutive sampling. In a hospital outdoor, for example, we don't know who is coming next, whose patient is coming next. If you wait there in the registration area of a hospital or a clinic, then you can see that people are coming for the service, and then you can recruit them one after another versus another versus another. This is called consecutive sampling. So these are not completely random because you have no clue. There is also some random elements, like you have no clue that who is coming next, but like it's not completely random because the day that you are there, some people maybe this is their off day, so they decided to come. So maybe they are having a particular symptom on, then they need to come. So there are some sort of influence who will come at a particular time or a day. Is kind of a determine their urgency to visit a healthcare for this particular time. So from your side, you have no clue that who is coming, but from the participant side, they have some sort of, the requirements that generated at that time. So that's what it is, kind of in between. It's like a little bit random elements there, but it's not completely random, right? So, but consecutive sampling is very useful when you do research in the hospital or clinic setting, or sometimes our students do research in the pharmacy, like whether the people come to buy antibiotic with a prescription or not. So they stay by the pharmacy side, and then they try to interview people who come to the pharmacy to buy medication. Then they interview them. So these are like the situation where you can do consecutive sampling, right? This is interesting, very interesting kind of sampling, right? What do you think? Very useful for public health research. So do you understand this consecutive sampling? Any question on it?
Professor, can you just briefly repeat it once again? I'm just confused a bit.
So can anyone help about consecutive sampling? What you have understood?
What does it mean by the series of consecutive cases collected with a condition of interest?
Mudabbara, you go ahead.
Sure, Professor. So what I understood, it's consecutive sampling. It means we go to some specific place, like a hospital or like in front of a medical shop, and whoever comes there, we just try to take data from them.
Yeah. But of course, you could have an inclusion criteria. Like you want
I
someone.
mean, whatever
Yeah.
comes in the inclusion criteria,
Inclusion criteria, like you can set like they need to be 18 years or older, or you can say, okay, I'll take both men and women, or only men is also possible. So you have to have your inclusion criteria, whoever matches.
and then whoever agrees.
Yes, and then whoever, of course, they need to do consent, right? They need to agree.
Isn't it like the convenience then?
It's not completely convenient, it's a consecutive, because you approach everybody that they comes in one after another consecutively.
Okay, got it.
So you want to approach everyone who comes to a pharmacy when you are waiting there, who comes for buying medication. So you ask everybody if they satisfy the inclusion criteria, then if they give you the consent, you recruit them. So it's not that's why it's not very completely a convenient sampling. It's a consecutive, because you are waiting for someone to come and then you approach everyone. But yeah, you don't leave someone because you don't like or something. If they satisfy by the criteria, you have an obligation to include them, whether they're educated, whether they're well dressed, whether they by their look or anything. There is nothing to exclude by this if it is not a inclusion criteria that you are pursuing, right?
So,
Okay.
Professor,
Yeah.
if this can be used on the population, like street kids or the beggars that we have in our country. So, if you suppose go to a railway station, and you can find a lot like those population there more than the other places. So, can we use this kind of samplings for those kind of researches?
Like if you go to the railway station or any other place and then want to recruit a certain type of population, like the beggar or the disabled people that there. So to me, if everybody is present of that kind in a population at the same time, if multiple of them are present at the same time, then it's not a consecutive. Consecutive is something that they're queuing or lining up to access. So that makes it more better to the term consecutive. So for example, the beggar, if you go to the railway station and there are 20 or 50 beggar staying there at the same time, so these are not consecutive, then you can apply some other type of sampling. Consecutive is something that people appear at time variant. At different time, they're coming in a regular fashion or a little bit irregular fashion, but you expect people to appear. So in clinic, hospital, pharmacy, or there might be other situation where people show up one after another in a consecutive way, right?
I get it, Professor. Thank you.
Yeah. So which sampling method to use in your research? So it depends, right? So depends on various issues. So depends on how many sample size that you have, and then what are the design that you are going to pursue in your research, and the feasibility also becomes an important issue also, because making a list of individual that is needed for simple random sampling is not possible for many situation. This is something probably is making it impossible. But for simple random sampling is needed for certain type of research. For RCT, for example, you cannot afford to do a purposive sampling, convenience or quota sampling or anything in the randomized control trial. So it is mostly that people will do the random sampling, systematic or simple random sampling for randomized control trial, where they see the drug, the efficacy of a drug or a vaccine. So they cannot rely on just purposive sampling, right? So the type of the research that also determines which type of sampling. Qualitative research, they do non-probability sampling, quantitative more probability sampling, and again of different types based on type of design. So I think with this we'll stop. What I wanted is this. Where is the screen share site? Okay. Yeah. So we don't have time, I know. What I wanted to do is like, in the sampling chapter that I shared, there is at the end, there are a good thing in every chapter that I realized that we can take advantage of it. So in the sampling chapter, chapter 5 that I shared with you, so at the end, you will see all these things that I somehow more or less covered in the lecture. So what I wanted to do, and then because of initial 40 minutes that we spent discussing, and then here, there is a small reading here, and then at the end there are a series of questions. So this critical thinking question, this one we wanted to cover, like it says that a tale of two samples. So what is mentioned, the 6 months ago, a statewide campaign of fill up on the fresh was implemented to encourage the consumption of fresh food. So in next class, so what I suggest that in this sample, the chapter at the end, page 88 and then 89, a little tale has been mentioned. So this is a kind of an assignment. It's not like you have to submit, but read this. So in the next class, so after you reading, there are some critical questions that we'll quickly discuss. Why do you think a random sampling was chosen over other methods? What other ways could NADZA have selected a random sample store? What would be the challenge of evaluating every single store in the state? How might her first sample of store impact evaluation result? What are the other ways to stratify the store? So this question we'll be discussing in the next class. So read this little story and then we can do it in next class, okay?
Okay, that's chapter 5, right?
This is chapter 5, sampling, yes.
Professor, can you please send today's lecture and also recording?